The only true wisdom is in knowing you know nothing. Chiari type 1 malformation and Syringomyelia in children often require surgical intervention. A new trial examined the efficacy and safety of posterior fossa decompression with Duraplasty PFD-D versus PFD alone. This multi-center, cluster randomized controlled trial included 162 participants, with 78 undergoing PFD-D and 84 undergoing PFD alone. The monitoring period extended up to 24 months. QuickTake, a multi-center trial compared PFD with and without Duraplasty in children with Chiari I malformation. The primary outcome showed 14% of participants had complications with PFD-D, compared to 6% with PFD. Secondary outcomes revealed 58% clinical improvement with PFD-D versus 46% with PFD, and mean syrinx reduction was 3.08 millimeters with PFD-D compared to 1.22 millimeter with PFD. The safety profile indicated no significant difference in surgical complications between groups. The authors conclude that larger trials are needed to determine the relative benefits and risks of PFD-D versus PFD. QuickTake. The trial found no significant difference in surgical complications between PFD-D and PF, suggesting further research is needed. Question. A 15-year-old male presents with Chiari type 1 malformation and Syringomyelia, with cerebellar tonsillar ectopia of 6 millimeters and a syrinx diameter of 5 millimeters. Based on this recent trial, what is the most expected clinical outcome or most appropriate next step in management? Option A. Perform posterior fossa decompression with Duraplasty to reduce surgical complications. Option B. Perform posterior fossa decompression alone to minimize surgical complications. Option C. Expect significant improvement in quality of life with either surgical approach. Option D. Expect no difference in clinical improvement between the two surgical approaches. The answer is B. The trial indicated that PFD alone had fewer surgical complications compared to PFD-D, thus making it a more favorable option in terms of safety. The key distractor, option A, incorrectly assumes that adding Duraplasty reduces complications, which the trial did not support.